In this demonstration, the nurse pulls the patient's medication history into the OMR and reconciles duplicate medications listed in their home meds. Later, the provider modifies the patient's preferred pharmacy in RX Writer and e-prescribes a medication. This is the 5th video in a series of 7.
The nurse begins by opening the outpatient medication review to collect home medications. She pulls in the patient's historical medication history by clicking the Meds from Other Sources button. A disclaimer will automatically appear and then close. She sees that Lipitor 20 milligrams has been filled for this patient in the past year, but this medication is already present in the OMR. So the nurse does not copy this medication into the OMR so as to avoid duplication. The nurse then adds a preferred pharmacy by clicking the link in the right corner of the outpatient medication review. She searches for Pathmark Pharmacy. She selects the appropriate pharmacy and then clicks Add to Preferred and closes. Home meds are then saved as complete. The provider then takes over. The patient expresses to the provider that she would like to use a different pharmacy, one that is closer to her home. So the provider opens Prescription Writer to add an additional preferred pharmacy for this patient. The provider clicks on the link in the upper right-hand corner of RX Writer and searches for Happy-Go-Lucky Pharmacy. She selects the pharmacy and then clicks Add to Preferred. The provider then makes sure that the default radio button is selected for this pharmacy and closes. The provider then enters a prescription for Lasix 20 milligram oral tablet. The provider then presses Review and Submit. To e-prescribe, the provider chooses the e-submit submit method. The provider then confirms her location and presses OK.